Welcome back to Hot Flashes and Cool Topics. We are here live at Wise Paws, and we are talking with Dr. Michael Krychman. And thank you so much for joining us.
Thank you for having me.
Dr. Dr. Krychman is a clinical health professor at UC Irvine and also at Ann's Clinic. And I think it's really interesting that you are an expert in survivorship medicine. Can we start with just explaining what survivorship medicine is?
So really, historically I came from Memorial Sloan Kettering. So when most people think about survivorship, they think about surviving cancer. And yes, indeed, that's the primary concept. I really work at the concept of prevention of disease and wellness and optimizing health. And it's kind of optimized and kind of evolved to this whole concept of chronic medical conditions, right? So as we age, as women age through the midlife and beyond, very often they'll have, up to 2 to 5 diagnoses, whether it's hypertension, high cholesterol, bone health issues, and really how do you modify your medical care to optimize that management in the face of chronic conditions. So survivorship really means about prevention, so we're going to prevent the disease from worsening or from reoccurring, plus how do we optimize wellness given your special situations.
That's amazing, because I don't think women even realize that there is something like that out there to talk about, because we spoke with Joan London a while ago, and she's always like, you need this file of tests as you get older that you don't even realize you need to have evaluated, like a bone density test, like your eyes, your ears, everything
Your
checked.
dermatology test, everything, yeah,
And
mammogram.
what can women do to start focusing on, okay, I might have hypertension. What should I say to my doctor to make sure that I'm getting kind of that individualized treatment?
Well, your point is really well taken, and very often women come to me and they'll say, you're finally the clinician who's putting all the pieces of the puzzle
Right.
together. So I think for me, there's 2 main issues. One is you have to build your healthcare team, right? And you have to optimize your healthcare team. And it's okay to fire your clinician. And it's okay to find another clinician. We know the average clinician will interrupt a woman, specifically after about 11 seconds after she speaks.
Really?
So you need a clinician who will listen, who's not in a rush, and who will be your partner. I always say a good clinician is never afraid of a second opinion, too. So that's the first and foremost, is develop your team. And that comes from women talking to women. It comes from being your own health advocate and doing research. And it also is very important for a woman herself to become empowered. You have to be your own advocate, and you really need to know how the healthcare system has changed, right? Healthcare system has changed. We're doing a lot of telehealth where, clinicians are being very much taxed. They're, have to see more patients in less time, and very often their needs are not being met. So women need to seek out specific clinicians who can kind of put the pieces together. And if you're not being heard, that's kind of the first option, is to find a place where you can develop that relationship.
It's so amazing to me because when I was reading about you, and it came up complex gynecology, and I said, Colleen, we've been doing this for 3 years. I've never heard that.
The term.
Right.
Complex gynecology. And it's amazing. It's hard for women to even find someone, I think, like you. Are there a lot of...
How do you find it?
Yeah, how do you find you?
Well,
Yeah.
I would say for me, it's probably a third. A third of my patients come from women who have seen me, and they're talking about the experience and talking about what they've done. A third are coming from the internet, and a third are coming from clinicians. So it's all about awareness. And again, the concept of complex gynecology is, I believe, how we're all living, right? We're taking supplements, we're exercising, we're all trying to optimize our health. We all have chronic conditions, we're all getting older. And I think those are very, very important. And the way the healthcare system has evolved is, you have a finger, you go to a finger specialist. You have a problem with your breast, you go to a breast surgeon. You have a problem with your eye, you go to the eye doctor. And one doctor will prescribe one thing and maybe not know what the other one is doing. And the body is a complex interplay, right? Everything interacts, right? So when you have, let's take cancer for instance, you have surgery, then you get chemotherapy, then you get radiation, and then you're put on medication. And that all has far-reaching implications on your bones, on your heart, on your vagina, on your sex life, on your mental evolving and surviving and living with that complex. But each clinician, the surgeon wants to cut, the radiation wants to give radiation, and the chemotherapy runs the drugs, and they're not looking at the big picture. So that's kind of what survivorship is looking at the big picture, taking a step back and saying, okay, what medications are you on? These all interplay. So it's very interesting. Just yesterday I had a very, what I would call very complex patient. She had a heart attack. She was on hormones, and if you have a heart attack, you're not supposed to be on hormones. But she was so debilitated that she couldn't survive without hormones. So I had to work with her cardiologist. I had to make sure she was anticoagulated and monitored and carefully watched. And she has hypertension and high cholesterol. So it's all these specialists working together in an integrated way. And it's very interesting. She comes to me as the survivorship person who's taking care of her vagina, and she says, you know, my biggest complaint now is hair loss. So I said, I pulled up the differential for hair loss, and I said, you're on 4 out of 6 medications that cause hair loss. Have you talked to the doctors who have prescribed that? So the heart doctor and the blood thinner doctor and what have you. So I think it's about this, we've become so ultra specialized, sometimes we don't see the big picture, right? So we do breast surgery, we remove the breast, and it's kind of like this just us syndrome, right? We're just going to take the other breast off. We're just going to remove your ovaries. We're just going to put you on this. And it's kind of like me in a renovation. I was just going to change, you know, the appliances, right?
But
and then we change the
yeah.
appliances, and
The
then
kitchen
the sink
becomes the bathroom, and the bathroom.
you know,
becomes
and then the sink didn't fit, and then there was a window, and we're just going to change the window into a patio door, and it's just a patio to nowhere. So it's just, where does this end in terms of more and more and more treatment without the far-reaching implications of an integrated system, and really focusing on quality of life. So complex gynecology, I think, really is about the complexities of women and how they change and how they're affected by disease itself, by what we do as clinicians to cure or keep disease from progressing, and about medications. And plus environmental issues and how women are influenced by what goes around with them. And the number one issue, I would say, is stress.
Oh, yes, let's talk about
It is.
Right.
because stress seems to exacerbate everything that you're
Right.
going through.
And very interesting data on stress and cancer. And, you know, we all know that when we're stressed, we kind of get a little tickle in our throat. We're not healing well. We know stress impacts our hormones. So women who are under chronic stress have lower testosterone. Lower testosterone leads to lower libido, leads to frustration, leads to lack of energy, leads to mood changes. So again, integrated system. Very interesting study that most people are not aware of is this concept of mindfulness, where you're staying focused and you're kind of decreasing your stress. They looked at genetic issues related to breast cancer survivors and their genetics and their genes. And one group had this intervention, one group didn't. The group that had the intervention seemed to have larger chromosomes and led to a lowered rate of recurrence. So we know that stress impacts our natural killer cells, our natural defense system. We're being attacked every day by all kinds of environmental toxins, all kinds of cancer stuff. I mean, it's just the way we live. And if our immunity is not well, because we're under chronic stress, that certainly will affect us. So very interesting about the integration about stress and fatigue, and let's lump in sleep there too, because we are chronically not sleeping very well. That all impacts how we function the next day, right? So menopausal women, they tend to not have a problem falling asleep. They have a problem staying asleep. So they have chaotic sleep. They have non-restorative sleep. So you may sleep 2 hours and then you're up, and then 2 hours and then you're up, and then 2 hours and you're up. You've slept a total of 6 hours, but it's not the same as sleeping 6 continuous hours. You're still feeling groggy. You're still feeling like, hey, what's that thingy you write with? I can't remember that word.
Yeah.
I know what it is, but I can't find it. Word retrieval, low libido, fatigue. So there's a lot of downstream issues related to aging and menopause as well.
With, we've spoken to a lot of women who have had breast cancer, and they're afraid, or have breast cancer in the family, and they're afraid to go on HRTs. What is your position with that?
So I think we have to understand risk, right? And the challenge with risk is when it happens to you, it's 100%, right? And I talked about this earlier today, right? We all take risk every single day and we don't really realize it. Everybody got on the freeway and drove here. The risk benefit was great, right? I'm going to risk being on the 405 or the 5 and freeway and LA traffic, which is pretty dangerous.
We're discovering that.
Yes.
And, or I live in Southern California and the risk of getting skin cancer is 1 in 30. You know, or, you know, I'm going to drive above the speed limit or what have you. I think it's challenging to quantify risk. So my position is, for breast cancer, I think if people have active breast cancer, my strong position is that they really should not be on systemic hormones, meaning hormones by mouth or by patch or what have you. Do I have women on that? Yes. And I will be very honest, I do have some women who are on that, and they have decided for themselves what's the risk-benefit ratio. And I would rather them be monitored closely and not overdosed and taking proper hormones and being monitored and have proper surveillance than getting it from someone random. But I think the challenge happens with when you have breast cancer, you're very often challenged both for hot flashes and for vaginal health. So vaginal, let's take hot flashes first. There are a multitude of things that you can do. So the worst thing that I would always say is I hear women say, oh, just grin and bear it, it's not a big deal. It is a big deal. I have women who can't function because of their hot flashes. And breast cancer doesn't define them, it's something that happened and they need to move forward. And there's a lot of things in our war chest that we can use, whether it's conservative measures that are over the counter, rhythmic breathing and yoga and mindfulness, and there's supplements like a Quell or Resolin, and there's a new cool product called the V-Cool, which is kind of a new product. It's kind of like a little heart-shaped gel pack you put in your undergarments, and it cools you off. And it's not hormones, and it really works. It was developed by a gynecologist who I know, and I think it's really new and innovative. And then you get into like supplements, and then you get into other prescription products that are non-hormonal that may be approved for other things that have been studied to help ease that. So again, it's kind of like a recipe, and you have to kind of pick and choose what will work for them. So I tend to not give hormones, but there's a lot of things that we can do. I have women that do acupuncture, I have women that take supplements, I have women that use a chilo, a whole variety of things, and sometimes you have to layer it, and it depends the extent of bother. Now, what about vaginal health? I think vaginal health is super important because it's not only about intimacy and sexuality. I think there are many, many breast cancer patients who have what I would call vaginal awareness syndrome. They are thinking about their burning, itching, painful, red-hot vagina 24/7. And it is really debilitating. I have women that can't leave the house. They can't get dressed because it is so painful. So it's not only about intimacy, it's about comfort as well. And again, same thing, conservative to more aggressive. And conservative, there's a lot of good over-the-counter moisturizers. And moisturizers maintain, they help the ridges, folds, elasticity, pliability, stretchability. And also the lubricants for lovemaking, you know, the lubricity and all those other facets as well are very, very important. And then for some women, there's the option of minimally absorbed local vaginal estrogen, and there's also alternatives. There's things that are precursors, like intravaginal DHEA and what have you. So I always say there is always something that you can do. There's always something that you can do. There's always new and innovative products coming on the market, and I think that it is really, it's a shame that some women are suffering in silence.
Yes.
And I think the challenge that I always see is sometimes women say, you know, if my healthcare clinician thought this was important, they would bring it up. And the clinician sits back and says, you know, if this was important for the patient would bring it up.
Right.
And I call that the conspiracy of silence. And I want women to be empowered to take control of their health destiny.
And we couldn't agree more. When you are seeing your doctor, and it might be your primary care, and you have 15 minutes with that doctor, and you can't prioritize all this, what can you do to advocate for yourself to get a more comprehensive kind of team together that's not just your primary care?
So what I think the most important thing to do is be prepared for your visit, right? So be prepared and try to think about what are the top, let's say, 3 issues that I want to address at this time. And start off your visit by saying, I have a multitude of things that I want to discuss with you, and this visit I'm going to focus on 3. And I think you have to advocate for specialists when you need them. And sometimes it's very important to get your clinician to say, I would say, the 3 most powerful words in medicine: tell me more. So if your clinician is not saying those words, you need to find someone who will. Because I think it's critical that you develop a team. And again, speak to your girlfriends, speak to other providers that you really trust and believe in. And I can't do it all. And I've enlisted a group of people that I know. I have people in LA County, I have people in San Diego that I know, and we develop a network of people that are really thoughtful and will listen. And of course, you have to set realistic expectations, right? You can't cover a lot of things at a short visit, but the new trend, is longer visits. I will be moving towards a newer facility in probably the next 6 to 8 months, where we're going to have 20 minutes, 40 minutes, and an hour visit. So it's a new trend. It's not just wham bam, 10 minutes and out.
Yes.
That's a great trend.
And it's quality care that is measured by metrics and by outcomes and by research. So I think it's really important to set the record straight. There are clinicians out there that care and that are going to listen. There's certainly those that are available. I think you have to do your research and your homework. And if your clinician is not listening, it's okay to fire them. And it's okay to find somebody new.
Women find very hard to do.
They
I've been going to the
Yes.
same doctor for 10 years. I
Right.
don't want to
Yeah.
hurt their feelings.
Right.
And you have to realize you're not hurting their feelings.
Right.
And you can be very frank and honest. And
Yeah.
my patients, I will tell you, I am by no means 100% perfect. My patients, come in and say, last visit I kind of felt like you were a little rushed. Let's talk about this again. And I'll say, okay, I'm sorry that you felt that way. Let's revisit one of those issues. So I think, and they've stayed my patients. I have patients, I don't know if you were listening, I have a patient of mine who's well into her 90s. She's been my patient for 20 years. She's still on hormones. She's doing amazing. But throughout the years, she's developed other chronic conditions, and we've optimized her. And she always now, we don't really do exams. She comes in every 6 months. She brings me good zucchini bread. We chat, and she's like, "You're my easiest doctor to talk to because everything else is all going well." And I think you just have to find an advocate.
Are there any websites that women can go on, like NAMS, obviously we recommend people to check out, but are there any websites you would recommend for women to go to?
Well, I think for menopause, I think the North American Menopause Society is probably the best, and they have Find a Provider there. There are, a variety of different things, like the American Association of Sex Educators, Counselors, and Therapists, ASECT. Is also a very, very good website if you're thinking about counseling or therapy for sexual health issues related to menopause as well.
Okay.
The American College of OBGYN is also very good as well.
Okay, great.
And do you have a website as well? So do you mind sharing that for our
I
listeners?
do.
Yes.
My new website is drkrychman.com.
Okay, and that's
Yeah.
Krychman.
Correct.
One last question. We've talked to a couple of doctors about breast cancer, and they have said how important it is to get a breast MRI, and how difficult women are able to. The doctors don't want to do it, and also something called the fast MRI. Are you familiar with?
So for me, I think, the gold standard is a mammogram. And I think for me, what the challenge is, it's very confusing with the guidelines, because guidelines said, when do you start? How often do you have it? So I typically, because remember, I'm also in a high-risk breast ovarian center, so my job is to kind of be hyper-vigilant, and I sometimes have people which we call the worried well, that are very anxious. So we do digital mammogram, and if warranted, we'll either get an MRI or an ultrasound. So an MRI is very important if you have very dense breasts or you have problems that are visualized in the mammogram. I think for me, annual screening is very, very important. I don't go every 2 years. And I know that some recommendations and guidelines say stop, but I have some 90-year-olds that are 60. And I have some 60-year-olds that have bodies like 90-year-olds.
Yes.
So I don't really ascribe to that, and I know my 90-year-old patients will be very aggressive, and they'll do very well if they find any issue. So I think you have to balance that between, and I would agree, it's very challenging with insurance and coverage
Right.
and cost as well. But this goes back into what we talked about before. So, and I'm not trying to toot my own horn, but if I want an MRI for a patient, I typically get it because I know how to fight for my patients. And that really is partnering with them and getting an advocate and working with my team that I have in my clinic to know how to play the healthcare game.
The codes
Is
and all
it
that?
all the cost and the codes above? Is that what
Well,
you have to
I mean,
fight?
it's also sometimes it's the effort, right? You've
Right,
got to
that's
do the
true.
prior auth, you've got to speak to them. Sometimes you need a one-on-one, you need to explain to them why it's necessary. And sometimes the person on the other end who's doing insurance or granting is not as healthcare savvy as you would
Okay.
assume.
Mhm.
Okay, that makes
Yes.
sense.
Yeah.
Again, it's being our advocates and,
Right.
and finding someone who's
Right.
on a
Who
team.
will support, yes.
And also realizing, and sometimes the insurance company says no, right? And then we have a discussion of what's the risk benefit of you paying out of pocket and it being super expensive versus your insurance is not going to cover it, and is there an alternative which is just as good, like can we do an ultrasound? And maybe we can get them to cover an MRI every other. So sometimes clinicians need to, step up their game to be an advocate for their patients as well.
Thank you so much, Dr. Krychman.
Yes, this was
Thank
really,
you.
this was great.
This was incredible.
Yes.
No, we
Thank
have
you
learned
so
so
much.
much today from everyone.
Yeah.
Thank
so,
you.
Amazing.
And you
It's
need to go
really
back to the
wonderful.
East Coast so we can have, we can be your patients. There you
Thank
go.
you. Well,
We were
there's good
sporting
people.
stuff.
There's
No,
great
we-
people on the East Coast as well.
I know.
So,
Thank you for
you so
taking
much
the
for your
time to
time.
come
do
down.
you know when this?